This pandemic can feel like a never-ending loop. Many are welcoming the lifting of restrictions, but experts nervously point out,
although we're on the downslope of this wave, we're not out of this yet.
With wastewater surveillance replacing PCR testing, researchers can't actually track the number of infections. Samples can indicate whether virus levels are rising or falling, and current data suggests the virus is stabilizing at very high levels. Still, Canadians now have more protection than ever before.
A combination of vaccine-induced immunity and infection-acquired immunity has raised our levels of immunity quite high.
Hospitalizations are also coming down, but the bigger picture does show nearly 4,500 Canadians are now lying in hospital beds with COVID-19. That's almost as high or higher than the peak of every other wave in this pandemic.
We still have a lot of cases that we're still seeing hospitalizations. We're not going to let that get in the way of the fact that we all want this over. And that's obviously a fairly dangerous position for us to be in.
Already, a more contagious subvariant of Omicron called BA2 is spreading in several countries, including Canada and the UK. The UK dropped masking and many other restrictions over a month ago. Now, testing shows COVID cases are spiking while hospitalizations and deaths are creeping up.
We know that many people in the UK have had COVID, so if they have a certain variant is able to rise and cause problems again, that's a warning sign for us.
As restrictions are lifting, health officials are warning measures could return in the fall. New variants remain a real threat. And while vaccinations and Omicron infections are offering us good protection now, some of that immunity will likely wane in the months ahead.